primarily belong to the social services cluster, which is headed up by DSWD.
That's why you work closely with
That's why we work closely with DSWD, that's correct. Well, I do a lot of travel around barangays, and one thing I have noticed is that each barangay has a list of which agency has been distributing relief items and providing recovery goods, the dates and the amount. And out of the 50 barangays I've visited, the overwhelming first agency that was there right from day one was DSWD distributing rice to affected families. I've only heard reports, and some of the spoiled goods was due to large amounts of rain. Rice getting affected by getting wet. Maybe some of the trucks weren't covered, or they were covered with plastic sheeting or tarpaulin. So I have heard reports that some of the rice was initially spoiled, but it was only a very small percentage, and understandably given the weather conditions in some areas. In a disaster like this, in an emergency situation, we do provide relief goods such as emergency water, emergency food, emergency shelter, but that's done on a short-term basis. Our focus in the early recovery stage is more on long-term sustainable support for livelihoods, for example, so that people can start earning a decent income to provide for their children's needs in health and education. Okay, we promote supplementary feeding for mothers, especially mothers that have malnourished children. So it's important that we train mothers on how to prepare local vegetables, how to cook them in a nutritious way, so that children get the full nutritional benefits of locally produced, locally available vegetables. It's a training program. It's not a handout. It's a hand up, not a handout program. So we give training for local farmers that want to diversify their crops, for example. But it's done in a long-term, sustainable manner. And the interesting thing about those surveys is that the number of severely malnourished children is very low. What's concerning though is the levels of stunting and chronic malnutrition, which is running over 50% of children. So it's a long-term nutritional issue in the Yolanda areas, and this was pre-Yolanda. I think probably what is of concern though is the apparent increase in sexual abuse of girls, and 10% of barangays reported an increase in sexual abuse of girls aged below 14, and obviously that's a real concern. Yeah, we do have a child protection program, and we work with the local barangay child protection committees and the community-based child protection networks to strengthen referral systems and reporting systems, so that if there are cases of abuse in a local community, parents, neighbours, friends know exactly where to go to report that. So that includes establishment of hotlines. The radio programs as well will be giving continued support from those organisations, and also having focus group discussions with local communities during the recovery process. So DSWD are a partner in that, and they're very open to feedback, to complaints from communities, but also importantly acting on those as well. And that's the purpose and objective of this new accountability project. Is we receive feedback from communities, and we act on that feedback. There's a public website that records all of the feedback and the status and management of that feedback. Relief and recovery program in Aceh, and have been involved here since November of last year. Very confident to say that the pace of recovery here in the Philippines has been a lot faster than in Aceh, and there's various reasons for that. We've learned a lot from Aceh. Aceh, the slogan "Build Back Better" was developed in Aceh, but it was very much a focus on construction. Here in the Philippines, we've gone further. It's building back better, stronger, and together. At the end of year one in Aceh, there were still 100,000 people still living in tents. Here, it's a lot less. From recent estimates, I think it's about 1,000 people still living in tents.